The dreams, I mean, you may face it, but you should be protected. So there should be a balance somewhere. You can use the blog, you can publish, but be safe also. So this one is not fair. You expect that your research could solve everything. So be careful sometimes. So we do researches with an unfair world. Sometimes there is a quotation. So pharmaceuticals, they do many researches to get the profit, to get the benefit. And who benefits? It's where the research comes. Researches are done in developing countries, pharmaceuticals, good drugs are developed, then you don't get them. If you want to get branded drugs in pharmacies, can me and you buy it in Uganda or in Ethiopia? I think no. It costs many thousands of shillings. The very potent antibiotics. It costs too much. The rank and file cannot buy it. But it's available somewhere in Europe or in America. Probably this research has been done within us. So this is unfair, but you can't help it. We have to struggle. That's why we are, I think, one of the purposes of our gathering is this must be just to solve so many health research, health system research problems. So do we need a specific ethical framework? Do we need specific guidelines? Anyway, I want to, with short time, there are different protocols. This morning, professor told us what kind of researches. 15 minutes I left. Okay, thank you. So these are the topics we can look about: the discovery and development, practice guidelines, new technologies that support providers and patients, new models of financing, education path, implementation and scale-ups. There are many alternate protocols that we can develop. We will share all this, so you can select one of them and then propose for your specific. This also, the designs of HSSR. This morning we have seen the qualitative, the quantitative thing, but this is also another option of the designs of health system research. The intervention studies. It's like clinical research. We can do that also. We can have exploratory study, descriptive studies, cross-sectional one. We can do comparative analytical studies. We can compare two hospitals or two zonals of health system. One is the control, the other is the intervention. How could it be controlled? Can anybody tell me about how could a hospital be controlled? We don't intervene like an individual. Give that to my friend, he don't do it to the other.
The impact of the faith and the other mostly of the routine activity.
Yeah, thank you. Sure. It could be implementation research. Huh? We just any clinical training, it can be education or information. Then you apply in certain institutes, the others, they use the colloquial, the old system, then you compare. Is it ethical? Can I ask, is it ethical?
Well, the ethical dilemma is difficult for me to answer, because sometimes if you have a question on those old researchers done previously, if they are not being done, what will happen is the knowledge of the scientific order. Some may be say that ethical, because if the drugs were not tested before, and if you are now want to test a drug, additional harm of the participants as well as the institute, we have to do. Otherwise, how can we say that this intervention will be better than others? If you know the effectiveness, you have to test with others. But if you are testing the effectiveness of something, you have to test first before saying that it has to be scaled up. So that's my...
That's fine. So you are challenging me. Do you have another alternative?
Yeah.
I have another alternative. For example, there is around our universities the MIS system, Management Information System, is applied in some of the hospitals. I mean, how to accept the patient and then go to the laboratory, bring the result, prescribe the drug, how the patient should go fast in 2 days, 3 days in the hospital. It was the Management Information System applied in some hospitals, in others not. So now she comes as a researcher to compare between the controls and the experiments. She calls them experimentals. She is not experimenting actually, but it has been done by the government. Now she can study as a control and experimental.
What?
You can study.
Yeah, but in most cases, such kind of researchers are, they say that this research is not ethical. For example, they will take some proposal to see now currently the government is going to have extension workers to treat a newborn with possible bacteria, serious bacterial infection that they can refer to the next level. And this is the national-wide journey by the government. If you want to study the challenge, the barrier, or whether this is appropriate to give the treatment by the health extension worker, if you develop a proposal, this proposal will not be accepted because
if you find
if it's unethical, giving the treatment by the health extension worker is not accepted, the next proposal will not be accepted. So why such research will not be accepted like that? If it's already in place.
You know, in Ethiopia, this particular in Ethiopia, the health workers, health extension workers, they are deployed all over the countryside. You train them for 1 year? 1 year. Yeah, they are trained, multiple trained. Pediatrics, adult health, maternity health, everything they are trained. But they are not physicians. You train them for 10 years, while we train 7 years a physician. Me, I was trained as 7 years when I was graduating as a physician. And then another degree, probably 15 years old. Because we trained them for 10 years, for 10 months. Then you deployed them there. Is it professional? Does professional ethics allowed to permit these people to treat your child, for example, my child? They treat with antibiotics. They intervene with most diseases. So it's a challenge actually. But when you want to do the research, the government may hesitate. This is a government policy, primary health care distribution for the community, was the policy of the government. But when you go there to see the effectiveness of the health workers, intervention of the population, you may have a different result. So do the government allow you? Come on, this is a very interesting example for health system research. So these are the types of research generally. You can be intervention studies, experimental studies, quasi-experimental studies, pre-post experimental studies. I think health system researches, there are 8 according to this author, Adnan. Thanks to him, there are different approaches for health system research. We will give you the literature also. So you will read it salient to health system research. The nature of the intervention is different. The type of subjects are not individuals. Units of intervention and intervention often different. Informed consent to whom? These are not, you go to the hospital, from where do you want to get the information? From the manager, from the medical director, from whom? So there will be a challenge, but sometimes we give what? Permission later. It's not ethical clearance letter and consent, but giving for the researchers from the hospital a permission later, so long as it doesn't violate some of the rights of the participants. Comparison groups, risk assessments, inclusion exclusion criteria, benefit assessment, these are explained very thoroughly in the literature, so we will offer you with the other approach for health system research is the priority setting, the capacity building, and the post-study benefits in many institutions. So you will have, so lastly, the professional ethics. So we know what bioethics is. Professional ethics is the ethics of medics, nurses, lab technologists, and others. So we need to differentiate between clinical practices and professional research ethics. Because health professionals, they cannot access the information they have to do a research. They should claim, or they should be asking consultants, they should get ethical clearances from respective bodies to do their research on their data. It's not because they have the access, they should do the research on that. So there is a difference between clinical practice and professional research ethics. But when we talk of ethics, our point is to tell you one story. If we say ethics comes from philosophy, is one part of philosophy. Somebody asked us during a training, do you Africans have your own philosophy? I mean, that's a very resourceful question to go down to the research ethics. Or otherwise, do we copy Western philosophy? So what is philosophy? It's a world outlook about manhood, about space, about time, about the world perspective, about religion, about culture, about everything. It's a world outlook philosophy. So do we have, in a very big meeting, after a very big experience in philosophy, he asked us, we all were Africans. What do you say? Let's conclude this facilitation by this question. Because it is the source of everything. Okay, Church.
And we believe that it is us, but not I. And I see, like in my country, Kenya, when we are doing the community studies, according to the National Science and Technology, they have accepted that you have to get the communities. But at the end of the day, the person who interview, you have to get the permission of that person. So I'm saying, as much as we are trying to say that we are living our reality and it is us. But when it comes to research, we live the reality of the Western philosophy of I and myself.
I think you are speaking very good philosophical words. I, we, us. Actually, it's not a direct answer. We need to differentiate between culture, taboos, day-to-day lives from philosophy. To give you a hint, we call it the Western philosophy. It is a Greek philosophy, the Latin philosophy. Plato, Aristotle, Socrates, many books written. And that there are different kinds of theories, dialectics, metaphysics, materialism, and so on. That is the Western type of philosophy. In general, the Western philosophy is individual liberty. You don't interpret liberty in mass in the Western society. It's individual liberty. I can give you some examples. For example, don't call an obese person a fat man. In Africa, do we select phrases to call a fat man a fat man? I don't know what is the real language, but in the US, individual freedom is very sensitive. So you call a fat man obese, or they call it horizontally oriented person. Just to respect individual rights. Previously, with the black community, I mean the colored people in the US, they call us negros, negros. Sometimes, but later on they become black, black community. What about now? Afro-Americans, African Americans, they call us that. And the old people, we call old, in our language. But the Americans, they call them what? The elderly. The elderly, they call them the elderly. So individual right is very sensitive values. You should not pass a line to violate individual rights. You cannot judge what the individual is doing. don't be judgmental. But when you come to our culture, we always have things. But do we have African philosophy is a question. If we can find literature written about African philosophy, I will be happy. And please dig up this information and get the information for your satisfaction. Do we have a philosophy really? Or are we the copiers? With anything. Don't tell me the judgment is, but please.
I have two things about African philosophy. Number one is that when we were discussing about the history of philosophy, that is the history of the Western philosophers, or the Hellenic, that is starts from the Socrates and the like. There was an argument that most of these ideas and thinking has a lot of influence. There's also influence in Africa, particularly Egyptian civilization. So there was something like there was a synonymous association between Egyptian civilization and the Western philosophy. So it's like it's only that Africans were not clever enough to document and defend their whatever they could call philosophy, and they were kind of taken by the Western philosophical kind of authors. But number two is that we have something called Ubuntu. That kind of philosophy which says that I am because we are, and we are because I am. And that has roots from primitive mode of production. That is, Africans were living in some kind of egalitarian life. And they could go for hunting or collecting some fruits together. So that kind of a concept is also applied as one of the fundamental aspects of African philosophy. So that is the justification. But another thing with regards to, this is out of the African philosophy, but it has to do with ethics or morality. So my question is, can we really reach a situation whereby whatever we say it's immoral or it's bad? Can we really say it's bad in itself, or it's bad because it is prohibited? Because there is some Latin word which says mala in se and mala prohibited. That means, so if it is mala in se, that means it is bad in itself. For instance, killing.
I can understand that.
When you kill someone in the forest, there is that kind of guilt that you feel. But when you steal from someone else's farm, and sometimes you are hungry, you have no something to eat, there's no way you can call it bad in itself. But there is something which is bad because it is prohibited. Now we come to the society, but a certain society prohibits some activities or some actions. So where do we put ourselves? Where do we draw the line?
It's fine. I think you are a good reader in philosophy. I'm sure you have. Yeah, he must be a philosopher, I don't know, but he kind of interesting. So earlier on we talked about relativism, yeah? So everything is relative. Something bad somewhere can be good somewhere, anytime, in place, in different situations. So we can consider many and various perspectives on the ethical arguments. The two opposites, the damage of the two opposites, whatever you call them, bad, good, days, life, any opposites, it can have a meaning, but it could be relative sometimes. That's what dialectics says. I think you are also guys with dialectics, like philosophy is very interesting. So I think we are through Ninja, yeah? Time is up. Okay.
Yeah, we have, if you may give from your experience dealing with ethics, especially when you deals with health systems research. You find someone is doing research and it doesn't really involve individuals, and they kind of request to have that proposal accepted without being taken to the ethical waiving. And others would argue that if that research, much as it doesn't deal with the individual, but you are going to ask those questions.
About the individual.
No, not about individuals, it's about the system, but you are asking individuals. These are human beings. In one way or another, you're taking their time, you might ask them questions in a way that they may not like it, and they might be attached to the system in such a way that they may be aggrieved. And so it must be taken to the ethical mode for them to review. What's your experience?
Okay. Institutional proposals are reviewed in our ethical committee board. But, for example, there were exit interviews. The patients, they go to the doctors in different office of the physician's bench. Then you have a qualitative study which is called exit interviews about the system, whether they are satisfied or not by the system. Then it's about the institute, it's about the government, it's about the system. So you need to get a permission from the hospital management to do such a research, because you are not sure how it's going to be interpreted. The research is fine, but it should be interpreted as it is begotten from the research participants, not in a different way. So to assure all that quality and assurance, we give ethical clearance. But it's not like individual research, it takes 15 days, 20 days, no. It could be expedited, we call it expedited review, very fast. There is very without review. For example, critical patients are there to evaluate their health status when they are not conscious. They don't have relatives, then you worry. Whom do you consult? Critical clearance is needed, but the hospital is responsible. But if it's about interviews, we always review it, but expedited review. Because there is no risky intervention which can have very high minimal risk report. There are risk levels. Highly risky, medium, low minimal risk, and we also assess them. And depending on that, we actually bring them just going to simple. Because the system is not there without individual solution. So I'm not sure if I answered the question, but it's a good question also.
The last one. Am I responsible, me who's doing research using secondary data, to what extent am I responsible for the ethical issues that could arise out of that data of which I was not part? So there's just that data set.
Secondary data. In our country, there is a statistical commission for the nation. They do have all the survey results there. They own that data, they do have a responsibility given by the government. If you go to the hospital, there are different disease pattern statistics also. Owned by the hospital, then by the region, then by the Ministry of Health. There are owners. So when you analyze it, not discrete, actually, probably you will interpret many statistical tests, and they say something. You need to get a permission from the repository owners. And then the ethical board should review your protocol, and then you can analyze the data. That is how it's done.
The question was, if maybe unethical practices occurred in collecting that data,
but the data is now already available and you want to use it for secondary analysis. To what extent are you responsible for being aware of or reporting any of the unethical practices that might have gone into primary data collection that you were not a part of? Was that your question?
Right.
If you are getting that data and interpret it correctly, and you get the ethical clearance, you are free to expose your data because you get a permission from the beginning. You are not responsible with the scandal, for example, that is going to be created, and you publish it. If you didn't get clearance, you will be responsible. They may deny that we didn't give you the data.
There's going to come a
As an
time.
example, so if the neuro produced some data and Crispus is analyzing it, will he be held responsible for the atrocities that were conducted?
Because somebody is going to read that publication that came out of that data, and then he says, reports and says, this is what happened, this is what happened, this data was collected from us, unethical, and it raises all those sorts of things. Who is responsible? Me who came and analyzed it?
I'm not clear what you are asking, but if you have a permission from the beginning, you don't have a risk. You can't expose that data with... Your responsibility is you have to analyze the data correctly, without any misconduct, without falsification, without fabrication, without plagiarism. You need to do that. Then you are not responsible for what is happening. But correct analysis is there.
Okay, let me follow up on this question. We as a researcher, do we have any moral obligation or responsibility to make sure that we are using ethical data?
Again, pardon?
I mean, we as researchers,
Yeah.
do we have any moral responsibility of ensuring that we are using ethical data? Or it's just that there were permission and then I know there's problem, but because there's permission, then I can just write or move on. As long as I'm going to collect it.
Researchers has generally responsibility. They have responsibility with what they produce, and as I said, they should keep not to have research misconduct behaviors. Otherwise, they don't have responsibilities. If you misinterpret the data that you get, you are responsible. You have a moral and ethical responsibility. You can even be sued. Otherwise, I think that is.
Can I ask a different question?
Of course. I'm sure Lydia is allowing you because time.
Well, Crispus is allowed, he's right.
Can I ask a question?
Yeah, sure. That's the last one.
A few years ago, I was involved in a study in Zambia that was looking at the emergence of private IRBs alongside the ones that are, the national RICs or the institutional IRBs that exist. And wondering from your experience in this region, to what extent the acceptance and efficiency of private IRBs alongside national IRBs seem to be unfolding, given that the purpose, a lot of people believe, of the private IRBs is to be able to fast-track applications for those that can afford to pay for fast-tracking applications for their research. And the ethics of these ethical review committees came into question. And I'm wondering if you have any thoughts on that, or whether there's been discussion on this over the last few years.
Well, thank you, Nasrin, for this question. Private ethical boards and governmental, in general, ethical boards are there in some countries. But there are nitty-gritties. When you are private IRBs, one, the amount of fee requested from private ethical boards is very high. Two, there are advantages on the other hand because they are independent. If I bring my proposal to my institute, IRB, I am the member of that institute, it can have a bias. Because the private has some independent way of reviewing it, but it has also some disadvantages. When they get together money, they could just waive researches and so on. So in Ethiopia it has been proposed, public health specialists were asking for license to have private IRB, but the government refused it. The reason is that we have a weak governmental IRBs around the country, and then we need to expand that first. Then if they couldn't equip the assignment given by them, then we will try to have individual IRBs. And our culture and political system, when it's deeply analyzed, it doesn't allow private IRBs to be set there, like private hospitals, that was the same, to review many research proposals privately. It's not allowed. But I think for the future it's one of the options because they are independent. And then the professionals which are within the independent review board, they can be complete because it's the government which do the quality assurance on the good office, combination of multidisciplinaries, the number of IRBs, their program is strict because that is their job. Whereas the governmental IRBs, it's an additional job, You give a proposal, it can stay for 1 year in the government because it's an additional thing. So we are going to that, I think. We can use both in combination.
In some of the universities in our country, you go there and then they tell you, please don't fail our students because we depend on the students to make money. So make sure they pass.
As a lecturer in a private university.
Yeah, so now the same experience can be on the private IRB, and then you have to please review and make sure all the protocol go through, otherwise we're gonna
we don't have business.
We don't have business. So
I mean we must go to that nothing. We must go to have the private IRBs, we must reach there.
yeah.
I think that the weakness, the personal, the moral behaviors within the society can affect how they perform. Now, even people can bribe the governmental IRBs also, whether it's outside the research or internal. When they are private, they are outside the institute. So we need to...
Yeah, I think we have to bring this up. You have something too? You could ask it after the in the next session. And I think ultimately, whether we have private or public IRBs, we probably should be thinking about having some regulatory mechanism up there that can be able to create standards for all these IRBs. But also that there should be some sort of appeal mechanism across the board. So if you throw out my proposal, I should be allowed to submit it to the next appellate IRB and see whether it makes sense or not. These are issues that I think as the field grows.
Reading and doing, but I thought it was interesting that after 2 weeks we tend to remember less of the reading. If you really are looking to help them create and evaluate and analyze, you might want to consider a more complex approach to the teaching that involves both the more passive ones and the more applied ones. So in terms of resources, with that in mind, with the strategies in mind, I'll talk about the resources that you will have available to you, some that are still under development. So first of all, you'll have a set of readings that will be shared. Professor Bayanen has prepared already some resources. They include the international guidelines that he's been discussing, and also some key journal articles, because there hasn't been much published on health systems research, but there are a few key readings that Professor Bayanen has sort of picked up and that we'll be able to share as part of this. And in addition, I imagine at each of your institutions, as was mentioned earlier, the IRBs or RECs or ERCs have their own guidelines and protocols and procedures. So probably those will be really good resources to have for your own courses, even though they might not be common across all of the different schools. Next type of sort of activity or something that you can do are these debate questions or statements. And Professor Bayanen did this a little bit in our presentation earlier, where he sort of incited you with statements, and that created a lot of discussion. So that might be one strategy that might be useful to get people thinking and to get people talking to one another. And so, for example, what do you think of these? Limited access to health services makes research participants vulnerable. Is this a good debate question that you think you might propose to your students? What do you think about it in general?
Seems to be a yes or no answer question. So it might just have a couple of few heads talk about it to either claim or disclaim it.
Yeah.
But generally it is a bit of a closed debate question.
So maybe it's too closed. Then how about others? What type of questions should we raise?
Some people might say yes, and others will say no. Then we can ask them what is the reason for yes, and who say no. What I feel, for instance, limited access to health service makes research responsible. I will answer yes, because they will fear that the participants might have a fear, and they don't participate in research, they might not get the service. Due to this fear, they might easily agree to participate in research. And others might say no, because as long as they are given informed consent, they will have the right to refuse to participate in research. So this might lead to discussion regarding the ethical principles. So I think that's the question.
Yeah. So we have a debate that's already emerging.
In one line, you remember that it's an open sentence to include everyone's thoughts. If you guide this sentence with an additional phrase, it can lead directly to yes, as Fish said, or no.
Yeah.
So it's better to have a bit demarcated phrases to raise different items. Now this morning's picture, we have only watched that picture, but we have a lot of items. This is even more than
Exactly, that's right.
I actually have my opinions different from Chris Professor's. I think it really helps to have a very polarizing statement that forces a yes or no, because I think that makes for a good debate versus it depends. And I think that way you can get a really strong decision on either way and allow for arguments for or against in a debate. So for example, the debate that happened and it was a health-related debate in terms of legalizing commercial sex work in Scandinavia. That was a very polarized debate in terms of what are the pros and cons. And I think if you don't stand on one side or the other, it makes it hard to have that kind of debate.
That's a great point. So it's this issue of not only being fairly limited, but also being inciting and being polarizing. So maybe even making these ones even more controversial so that they'll have a more instant response of yes or no, and then people explain what they are. So I mean, this is just one example, and I think what I'm hearing is these characteristics that a good debate question should have. So based on that, what else? Are there a couple of other examples that one could add to put in the toolbox that we give to you as you go and teach this course at your institution? Maybe from your own experiences?
The greatest help is for the trainers to set themselves what to teach to the trainers, and to assess the level of knowledge you have. Not like it's a culture of training, whether that could be applied here or not. We can also take as an option of pre and post test, pre-training and post test for training tests.
Okay.
Can be multiple choice, true, false, or
Yeah. So then I'm suggesting having some questions that perhaps you can administer before the training starts. And this might include questions about ethics, maybe it includes questions from the other modules, like what is health research. And then having some questions administered after the training to see how did the knowledge change. And that would really help you as an instructor see, what are the concepts that really gel and which ones are maybe weaker. Christine?
They come and discuss amongst themselves.
I think that would be one of the...
Eric? And then...
Yes, some question about when we have a participative research. When you have a participative research with the community, but you try to have a meeting near the health center. So sometimes supervisor said that it's not ethically possible because they are influenced of health provider because they are near health centers.
Yeah. So this is like another great example. Perhaps giving participants a case study or a problem that they can solve, some of the risks that you're exposing yourself to, or if it's a problem-based learning to get people to work together. And maybe then I should continue. Maybe I should continue, and then perhaps we can have we can add more as we go along. Because another thing that might be interesting was also the idea of testing concepts. So in terms of testing concepts, again, perhaps we go to the pre-test, post-test that Vanna suggested, perhaps using some multiple choice questions or true or false to test the concepts that were mentioned, like beneficence, justice, autonomy, or to test people about their knowledge of the key historical reports or milestones that happen in ethics, or about the 8 dimensions that are particularly salient in health systems research ethics. So those are all concepts that perhaps are easiest tested, whether the knowledge is there, so the lower order thinking skills through multiple choice. And then there's this idea of, can they apply them, and how can these concepts come through, for example, through role plays? You give students an opportunity to talk about how to administer an informed consent process, enacting a case study or a problem, as was mentioned by Eric and Christine. This might be an area where a breach has happened, or maybe where some risks are potential because, I don't know, you're discussing your research at the research site, and you might influence privacy confidentiality in a negative way. Or maybe there's data management issues. Data has been lost, data has not been anonymized, and you can provide them with a sample sheet where they can either individually or as a group go through the problems associated with a particular case. So I'll maybe just continue, and then we can have a joint discussion about what other ways you might want to use to test concepts. Then there's also the applying them, and this might be done, for example, by critiquing a sample IRB protocol. I'm sure you have many that you can use to give to your students, where they can see maybe what were the gaps, or you could also insert wrong information in the sample IRB protocol and have them identify really what is wrong and how to correct it. And the same could be done for a consent form. And you might have other examples for how to actually assess them in applying concepts. So let me pause there and see how else can we, what are some other ways that you think these health systems research ethics can be, concepts and applications can be tested? How can you use them in your future administration of this unit? Or what are you using currently that might be useful to share across different universities? Christus and then Eric?
To write a simple research protocol and then have particular focus on how you would go about the methodology section that really includes the ethics of getting the information. So I think it's one way of working with the students, developing just let the students develop a small protocol of a topic, and so they emphasize raising the ethical issues that would emerge and how they would go about, for example, community entry or getting the necessary data that they need.
Great, thank you. So that's a great example. So thinking about the ethics in relation to the methodology, and in many ways this raises maybe a bigger issue that ethics should be thought about not just in the application to the IRB and then you forget about it. It's really in the methods it should be addressing issues both in terms of data collection and data analysis. And then throughout the, life of a project, I know that IRBs usually have progress reports where you have to sit and think whether there are breaches or issues that one might need to report. So really thinking about ethics throughout the course of the proposed methodology, from the initial proposal to the actual data analysis. Eric, you had your hand up?
Yes, I would like to say the same, but we also can ask them to make proposal, but in some sensitive topics as HIV, the IST, something like this, and to ask them to be more specific when they are talking about ethical consideration, to be sure that they understand what they can ask and what tools they have to put in the protocols as annex, something like this.
Yeah, exactly. I'm sorry, I don't know your name. Joanne and Christine.
Yeah, thank you. I was also thinking of one way to really apply these concepts is to critique a journal, a series of journals that are touching on different aspects of health systems. And this can be, critiqued in small groups and then presented. And then they see how the concepts play out, right from designing the health systems approach to the ethical issues. So it would include journals, and like as time goes on with these journals are updated, the articles are updated, newer articles that are touching on different aspects of interest, incorporated into the teaching course.
I see. And just to clarify, do you mean journal articles on health systems ethics, or published journals of examples of studies, and then you think about the ethical components of it, or both?
Either.
Okay.
Either can work. Because you can find an article that really had ethical challenges or had ethical controversies. Some of the articles actually do publish about the violations that keep occurring in the ethical practice of studies, even in the face of guidelines.
Yeah.
So those can be good starting points, because they usually refer to these to renew, to modify, and update ethical, principles. So those can be on that, and then the others can just be, straightforward scientific articles that are directly looking at the health system aspects.
Great, thank you for that suggestion, Joanne. Christine?
Actually, it's the same thing that Joanne has. Somebody presents what they have critiqued, then the other ones can give input to see whether there is anything they've missed. I think that would be another.
Yeah. Great, thank you, Christine, for that suggestion. Any other thoughts? Eric?
There is another. So you provide students with this guideline, and you ask them to check if their own exercise fits what is asked in this section, so they can be sure to make it as assignments.
Yeah. So like a self-assessment, like they have a checklist from the IRB or prepared by the instructor that says, well, for your protocol you need to have A, B, C, and then they can go and reflect on whether they have met that criteria. That's a great suggestion. I think that you provided some great examples, and I think that when it comes to actually teaching this unit or the other units, we'll have to really reflect on, well, how much time is actually given and what is the mode of delivery. So that goes back to what Christmas was saying this morning, that there are actually, some institutions might choose for an online course, some might go for a 20-week course, some might have a workplace project. So I think that it's then the decision to take which of these assessment concepts or approaches would be most applicable to that particular setting.
I wonder whether there's some kind of balance between the various forms. Given that a lot of times when you sort of teach something on research methods or whatever, there's still a complaint later that people didn't apply in terms of protocols and so on. I wonder whether it's worth discussing where should we lay emphasis in terms of which kind of exercises should we carry out to be as effective as possible, given that what we want is for it to be applied.
Yeah, that's a good question. So where the balance should be? Should it be on testing concepts? Should it be on like building the right type of proposals? Is that what you mean? And I think that I guess I'll give my personal opinion, but then I'll also ask Diana to answer, because I think that it's important to know the rationale for doing the informed consent and doing the IRB, because oftentimes, and maybe I'm sure this is not just my experience, IRB becomes very complicated. It becomes like a bureaucratic process, and as you struggle to get approvals and to submit applications or multiple applications, I was just telling Nazreen and Crispus and Christine that I ended up submitting 5 applications for my dissertation. So as that was going on, it could seem tedious and unnecessary. So it's good to know the principles and why we're doing this in the first place. At the same point in time, it's also good to know like why is health systems research different. So focusing on testing to make sure that people understand, what risks come up when you interview somebody in their professional capacity. It's not the same as giving blood. It's different. And you have to be mindful of that. Or, how do what's the protection for researchers when they identify corruption? But then like when sort of the rubber hits the road, you have to know how to put together a good proposal. And you also have to know how to apply these concepts and have the right information and consent forms so that, the right data management strategy so that you can pass through IRB. So it's, I would say, I can't pick because I think all are important. I think each institution might also have additional ethics training. So I don't know. Diana?
HSR. This morning, it was important that we see what the dimensions of HSR, the vertical, the horizontal, the oblique dimension of HSR there. And the chaotic structure of the health system. There are some research examples to be assessed during the training. Concentrated on HSR, it will be important. Considering what to give an example on this point. Otherwise, the general principles also can be a sort of